Welcome to our video about understanding and treating depression. Today, we're delving into this pervasive condition that impacts millions across the globe. Please remember, the information shared here is purely educational and not intended as a replacement for professional medical advice. Always consult with your healthcare provider for decisions concerning your health. This video is simply a tool to enhance your knowledge and awareness about depression. Now let's dive into our topic, depression. First, what is depression? Depression is a mental health disorder characterized by persistent feelings of sadness and a loss of interest in activities once enjoyed. It's not just a bout of the blues or a normal response to life's ups and downs. It's more complex, more debilitating. It can make even the simplest tasks like getting out of bed or eating a meal feel overwhelmingly difficult. It's important to understand that depression is not just feeling sad, it's a complex mental health disorder. What causes depression? This question takes us into a complex interplay of factors. Depression isn't caused by a single element, but rather a combination of biological, genetic, and environmental influences. Firstly, let's look at the brain. It's like an intricate network of highways, with chemicals called neurotransmitters acting as the traffic signals. When these signals get disrupted, it can lead to depression. It's a bit like a traffic jam in your brain, preventing your mood from flowing smoothly. Genetics also play a part. If depression runs in your family, you might be more susceptible. It's as if you've inherited a map with a tendency for more traffic jams. Lastly, life circumstances matter. Stress, health problems, relationship issues, and even certain medications can contribute to depression. It's like roadwork on your brain's highways, causing unexpected detours and slowdowns. Depression, therefore, is not a sign of weakness or a character flaw. It's a complex disorder caused by a combination of biological, genetic, and environmental factors. Scene script. How do I know if I'm depressed? And how is depression diagnosed? These questions are crucial when it comes to understanding depression. Often people who are depressed feel persistently down for at least 2 weeks. And this feeling is accompanied by at least one of two symptoms: a pronounced lack of interest or enjoyment in activities that were once pleasurable, or a persistent feeling of sadness, hopelessness, or irritability. There are other symptoms that may also indicate depression. These can include changes in appetite or weight, disturbances in sleep patterns, feeling of fatigue or lack of energy, feelings of worthlessness or guilt, difficulty concentrating or making decisions, or even recurring thoughts of death or suicide. Now let's talk about diagnosis. If you suspect you might be depressed, it's crucial to consult with a healthcare professional. They will carry out a physical exam, ask you a series of questions about your mood, behavior, and daily activities, and may also order some tests. These steps are essential to establish a diagnosis and rule out any other potential health issues that may be causing or contributing to your symptoms. Remember, depression is a serious condition that can have a profound impact on your life. But it's important to know that help is available, and the sooner you seek it, the better. If you think you might be depressed, it's important to seek help immediately. What are the treatments for depression? There's no one-size-fits-all answer, as depression is a deeply personal experience, and its treatment is equally individual. However, a common starting point is a comprehensive evaluation by a healthcare professional who can map out a treatment plan that best fits your needs. Counseling, also known as psychotherapy, is a crucial part of managing depression. It involves regular sessions with a psychiatrist, psychologist, nurse, or social worker who can help you understand your thoughts and feelings and develop coping strategies. Medication can also be a potent tool in the fight against depression. Antidepressants can help regulate neurotransmitters, the brain chemicals that affect mood and emotions. It's important to remember that these medications take time to work and should always be taken under the supervision of a healthcare provider. In addition to these traditional approaches, lifestyle changes can also be enormously beneficial. Regular physical activity and a balanced diet can enhance your overall well-being and mood. Limiting alcohol and avoiding illicit substances is also crucial, as these can exacerbate depression symptoms. In some cases, Other treatments are considered, like electroconvulsive therapy or transcranial magnetic stimulation, which use electricity or magnetic fields to stimulate the brain. Depression can be a daunting adversary, but it's important to remember that it's treatable. With the right help and support, you can regain control of your life. Depression is treatable, and with the right help, you can regain control of your life.